Hello friends, today we are going to discuss regarding hypertensive urgency. So hypertensive urgency is a sudden, severe elevation of blood pressure which is more than 180 by 120 mmHg without and organ damage. It is noteworthy to emphasize that in a patient with hypertensive urgency, there is no immediate threat to body or any organ. So, rapid reduction of blood pressure is not required and it can be even dangerous. Rapid reduction of blood pressure can lead to myocardial ischemia, AKI, or even stroke. So, the goal is to reduce blood pressure gradually over a period of 24 to 48 hours using oral medication. Never use IV medication in such cases. Never aim to stabilize and normalize BP immediately in such cases. So, target reduction is to reduce mean blood pressure by 25% over the first 24 hours. Now, we will go through the stepwise approach. Step number 1, to confirm if it is a case of true hypertensive urgency and not emergency. Before treating any patient, we should first see if there is involvement of brain in the form of encephalopathy, stroke, confusion, or there is involvement of heart in the form of myocardial infarction, acute pulmonary edema, or if there is involvement of kidneys in the form of oliguria or AKI, or if there is involvement of eyes in the form of papilledema. Because if any one of these are present, then it is a case of hypertensive emergency, not hypertensive urgency. So first we have to rule out any sign of and organ damage. Second, step number 2, we have to identify and treat the cause. So we have to look for the causes, which the causes may include: number 1, non-compliance with antihypertensive therapy. Number 2, pain and anxiety. Number 3, NSAIDs, steroids and certain other medications. Number 4, volume overload. Number 5, secondary hypertension. So at times, if we just find out the cause and treat the cause, it will alone lead to reduction in blood pressure. Step number 3, start oral antihypertensive therapy. Number 1, amlodipine. So amlodipine is the most commonly used drug. It is safe and it can effectively lead to reduction in blood pressure. Number 2, labetalol. Labetalol can be used in pregnancy and in cases of tachycardia. It has both dual alpha and beta blockade. Number 3, captopril. So it can be used in RAS mediated or RAS driven hypertension. It has fast oral onset. Clonidine, number 4th. So clonidine can be used in cases of sympathetic overactivity. So drug should be started based on patient profile, not on blood pressure reading alone. Number 4, observation. So we have to monitor blood pressure every 30 to 60 minutes. We have to assess symptoms, and usually these patients can be observed for 4 to 6 hours and they can be discharged with medication optimization. No ICU admission is needed in such cases. Then at last, number 5, long-term blood pressure control. So after stabilization, we have to adjust the chronic blood pressure drug regimen. We may add second or third drug if needed, and we have to modify risk factors, or lifestyle modification can be done in the form of salt restriction, weight reduction, smoking and alcohol cessation. So, in hypertensive urgency, our goal is to reduce BP gradually over a period of 24 to 48 hours using oral medication, not by using IV therapy, as organs have already adapted to high pressure state. Thank you.